All right, welcome to webinar number 6. This is all about using Spidertech to help with balance and proprioception. A very exciting topic for me. It's kind of how I began my journey with Spidertech, how I fell in love with their shoulder ProCut kinesiology tape. So we'll kind of tell a little bit of that story. We'll kind of understand how it affected myself, my patients, people I work with. And then we'll learn all about how we can optimize our search for more proprioception, help people improve their balance using kinesiology tape. With the beginning of all of our webinars, we start with our mission at Spidertech, and essentially is to make your life easy as a clinician using our kinesiology tape. Our mission is to elevate your client recovery by arming you, the medical professional, with a streamlined kinesiology tape solution, a solution that is the highest quality tape you can get, a solution that looks and feels great, and a solution that your patients will be thrilled to use. This is me. This is the bio. The important thing in here is my experience in golf and tennis. I've used Spidertech to help with proprioception throughout my career in those two sports, and really benefited from my understanding of how I can use the tape to help my athletes. The secret is that this enables them to be better on the court, on the golf course, while I'm not able to physically touch them. While I'm on the sidelines, but I can have an impact because we're using tape to increase proprioception. All right, so our goals are pretty simple for today. We're going to learn how Spidertech can affect balance and proprioception, and then we're going to review the shoulder ProCut and understand how this ProCut has a huge impact on proprioception for your patients. Hopefully everyone knows what the benefits of Spidertech are by this point, but all of our one-piece kinesiology tape that is designed for each part of your body, it really makes your life easy as a clinician. It makes your application of kinesiology tape more successful by taking advantage of all these things. It's standardized. It is simplified. You get the same you get the same application every single time. Your patients become familiar and they get a consistent treatment. It is long lasting due to the fact that it is all machine cut. It is engineered to be all one piece, and it all leads to being the long lasting application. It is reproducible because it comes the same thing and same piece every time, saving time for you both in the application process, in the learning process of how to use tape, but also in the note taking and being able to kind of recognize exactly what you did for your client or your patient that day, and being able to provide the same treatment the following time without having to make extensive notes about positioning of tape and so on. And then you can also apply it anywhere. You can apply it in the clinic, but it can be done with as long as you have your skill and knowledge. It can be done anywhere, and you get the same experience. So to begin with, I think my experience with using tape for proprioception started when I hurt my shoulder, probably 13, 14 years ago. It was sore for a while, and I remember seeing therapists for treatment, for therapy, and I would say, like, it just doesn't feel like my shoulder belongs to me anymore. It feels like it's kind of just like in the wrong position, and I can't figure out how to change that. And it really wasn't until I went to a Spidertech course, I had the shoulder ProCut put on my shoulder, and instantly it felt like my shoulder belonged to me. It fit within the socket better. It just felt like it was in the right place for the first time in a long time. And I believe that had a lot to do with now the kind of the proprioceptive awareness that I had of just not only the shoulder joint, but all around the shoulder blade, around that scapula, letting my brain kind of know every positioning of it. And so that helped me in the gym afterwards. It helped me in my positioning. It helped me with everything I did, just understand where my shoulder was. And as a result, it felt like it belonged to me again, which was life-changing. Understanding that, you can appreciate that I also took that into helping my clients and my patients. And so I would use it with my tennis athletes when they got sore, especially in clay season when they're doing a lot of sliding. We would put it on the adductors into the inner thigh if they would do a lot of split sliding and they were getting sore. This enabled them to be more aware of their positioning, to make sure they didn't go into too much of a split position, causing injury because of fatigue or tiredness or aches or pains. And so became very successful there. On the golf course, we would be away at training camps, and they'd be working hard. The athletes would be working hard in the gym, and then expected to go perform on the golf course. There's times where they weren't able to feel their legs, their hips, their feet the same way that they were used to, their arms the same way they were used to. And so we would use kinesiology tape on those areas that were sore. Feeds the brain with information about those sore areas that used to be wobbly. And now all of a sudden they can feel their hip as they're rotating into that lead side. They can feel their legs, they can feel their shoulder. So all of a sudden they are like they were if they came into that round of golf in a normal state. Okay, so we'll dive into what we're dealing with here with balance and proprioception. Balance being the bigger, broader category, essentially the ability to distribute your weight in a way that lets you stand or move without falling or recover if you trip. Essentially, your ability to kind of keep your balance and perform with that. And then the proprioception, which is really what we're affecting, and the balance is a result. But the proprioception is the multi-input sensation whereby afferent information from the mechanoreceptors, and that's where the tape comes in. The mechanoreceptors in the skin, muscles, ligaments, and tendons is integrated with the visual and vestibular inputs in the central nervous system to build a perception of position, sense, movement sense, and force detection. So essentially, if we can increase the information going to those mechanoreceptors through the tape, now all of a sudden we know where we are in space, and you combine that with the length changes in muscle, with the force changes in through the tendon, feeding the information back to the brain. Combine that with your visual system and your vestibular system, and all of a sudden we have a greater understanding of where our body is in space, and that essentially is how that we maximize our proprioceptive ability. Downstream also is very reasonable that if we're using the tape to decrease pain, we're getting rid of swelling, so our function is greater. Not only are we feeding the information to our skin and those mechanoreceptors, but we're also able to be more active. So we're taking advantage of the receptors, those Golgi tendon organs that are detecting the force changes in the muscle. The muscle spindles that are sensing the stretch in the muscle. So the more active you are, again, the more our brain knows where we are in space, and the more we can recover from proprioceptive issues, the more we can increase our proprioceptive awareness and abilities. And so that's kind of where the tape is almost like a secret weapon to feed that brain with information, especially when we're not at our best due to injury or fatigue. All right, so we mentioned the mechanoreceptors. The primary mechanoreceptor that we are taking advantage of with kinesiology tape with Spidertech is our Merkel cell. The reason for that is quite simple, although we do have an impact on all the mechanoreceptors as we move, and there's pressure applied to the areas of the body and so on. But the reason why the Merkel cell is a primary one that we take advantage of is the fact that it is a slowly adapting neuron that has a low threshold value. What that means is that it takes virtually no displacement in your skin to still feed the brain with information. So wherever you are in space, whether you think you're standing still, that's still going to be enough movement underneath the tape on the skin to feed your brain information about your position sense. So through this Merkel cell, the tape is able to, through kind of grabbing and pulling and stretching on through the interface with the skin, it's able to feed your brain with information about your positioning, your whereabouts, and so you're constantly getting proprioceptive awareness about the place that the tape is over top of. And the reason that is the case, the secret of Spidertech is the elasticity in the tape. We have that cotton fabric with an elastic property to it, so it goes on the skin, retracts back on itself, elevates the skin, lifts the skin, and it's that lift that gives us all most of the great benefits that it does. So yeah, it's that lift in through the elasticity that is going to help with the proprioceptive positioning of where you are in space. In addition to the pain benefits, in addition to the muscle normalization benefits, in addition to the getting rid of any kind of pooling, swelling, inflammation, any kind of fluid that's stuck in that area, in addition to all those things. All right, we are going to jump into a couple studies. We're going to go over 3 studies today. They all kind of cover a little bit different aspects, different parts of the body where we increased our proprioception. And so they all give a little bit of a window or a story into how you can use it with your clients, and hopefully get some ideas as to who can benefit from this. So the first one, we look at elderly men, and we're looking at taping on over top of the knee. The tape that they used in this study was virtually identical to the knee pro cut that Spidertech has. And so what they did and what they were studying in here is they wanted to look at what is the impact on fatigue, on the ability for elderly people to be able to balance their proprioception. And they predicted that the fatigue protocol would have a detrimental impact on that. And so what they did, and you can see the protocol on the bottom of the slide here, was they they taped up half of the people in the study. They did a warm up. They tested their dynamic balance, their postural stability, and their knee proprioception. What they did for those 3 things, dynamic balance was a step over test. So they had them walk in a hall, step over a kind of a hurdle, and then continue on. And they tested their ability to kind of stay in that same path without swaying from side to side. They tested for postural stability, and that was just a single leg stance test. Eyes are open there, and they tested the changes in center of gravity, swaying from side to side. And then for their knee proprioception test, they tested the ability to kind of recreate a range of motion in a seated position. So they would be seated in position. Their knee would be or foot would be off the ground. They would show them the angle they wanted to reproduce, and then hold it there. They would have them kind of come down to the seated position again, and then ask them to reproduce that angle that they decided on. So they tested those 3 things. Then they had them jump on a treadmill for 30 minutes walking downhill. They anticipated that would be enough to fatigue elderly men, men over 65. And then they tested the same things again. They tested that dynamic balance, postural stability, and knee proprioception. Very simple. And what they found was, without the tape, that is the first line across, their dynamic balance, so their step over test, they had essentially a 10.5% decrease in their ability to do that without swaying. When they applied tape to the knee, they found, or in the group that applied the tape to the knee, they found that there was essentially no change. So they were able to do this test essentially identically before and after the fatigue protocol. They tested the postural stability. With that stork stance, that single leg stance, there was a 20% decrease in their ability to hold that stance in a normal position without swaying, changing their center of gravity, or falling. And when they added tape to that, what they found was there's only a 3.5% change or decrease in their ability to do that stance, hold that position. And then when they tested the proprioceptive ability, that knee reproduction, that positioning, there was a huge difference in their ability to reproduce the angle they were asked to do, a 50% decrease in the ability. And then again, with the tape, there was essentially, well, there's a 3% decrease. And so with all these three tests, like within 3% of getting back to your normal state of being, which pretty significant when we think about what a 50% decrease in your ability to know where you are in space is, a 20% detriment in your ability to stand on one leg without swaying. And then a 10% ability to decrease in going over a hurdle. So what this turns into me doing in clinic is any time that I have a patient who's going to be doing more than they currently would be able to do physically, whether that's go for a longer walk, whether that's work harder in the gym, whether that's play 5 sets of tennis instead of 3, whatever that is, I'm putting tape on the area where I suspect they're going to break down, the area that they get fatigued earliest. And by doing that, I can be confident that I'm keeping them as close to their normal state of function as long as possible, and in doing that, making it so that we're decreasing the chance of injury from having a position sense that has decreased. So not only from a performance, but also from a injury preventive standpoint, I just get in the habit of I put it on on my clients all day, every day, and that position that I think is going to break down first. And I'll say that when working with especially older clients, there's nothing worse than a fall from a injury standpoint, from a embarrassment standpoint, from a people thinking like just not being able to kind of function on their own standpoint, from a maybe I shouldn't be exercising as much, maybe I should pull back, maybe I should be taking it easy. All things that lead to a worse outcomes in a life that is not as active as it should be. So I think this is a huge thing to be able to prevent a fall from happening with all the people you care about as clients and patients. All right, and so as a result, as you would expect, the conclusion is that the tape is able to deal with a dynamic balance, postural stability, knee proprioception caused by physical exercise, maybe attenuated by the application of kinesiology tape in the cohort of healthy older men by preventing exercise-related impairments of balance. Kinesiology tape may help reduce risk of falls and associated injuries in active elderly adults. So that is an excellent conclusion. That I think that also spans to all people who are pushing their limits and fatiguing more than their body is used to. Okay, so jumping into our second study, we are going to look at this one at the ankle. With this study, they looked at the immediate effects of kinesiology tape on muscle strength, static balance, and proprioception, and we also used a fatigue protocol to essentially create the impairment. I will say that I think there's also there is a significant amount of research that would say that a fatigue protocol will react similar to an injured area of the body, and so although this enables them to kind of just use everybody, so it doesn't require an ankle injury, you can equate the fatigued person to the injured person who's recovering from an injury in a kind of a reasonable way. So if we look at the study design here, it is very similar to our study design of the previous one. And I will say that this was people in their 20s, so this is young, athletic people. So what they did with this study is they didn't tape them before the fatigue protocol, which the previous study did. This one they waited till after the fatigue protocol, and they had them do, as soon as they did that, they either taped with kinesiology tape, athletic tape, a sham taping, or no taping. And so each person in the study went through 4 different sessions, and they had a week of recovery in between the sessions. And then what they did after the fatigue protocol and the taping is they measured their proprioception, their balance, and their strength. We're going to focus on the proprioception and our balance for our purposes today, but we'll also take a glimpse into the strength as well, just because we got good results there. All right, so with our proprioception, they looked at a very similar thing with the ankle here. They looked at the ability to reproduce the angle of a selected angle of the ankle with tape on. And so what we saw here is, in both cases of dorsiflexion and plantar flexion of the ankle, that there was less of an error after applying the tape. And so you see the black box in both these. What that shows is they were able to get closer to the desired angle of the ankle that they asked for, compared to all other taping jobs, whether it's no tape, sham tape, or athletic tape. And athletic tape was your standard kind of strapping with athletic tape. And what we saw was, if we look at your ability of using kinesiology tape versus no taping at all, similar to the way that we did it with the first study, was that in plantar flexion, we saw a 37% increase in your ability to predict where you are in space and reproduce that joint angle. In dorsiflexion, there was a 53% increase in the people in the study's ability to reproduce a joint angle, so a 53% increase in their proprioceptive ability. And keep in mind that this is in healthy people without injury, just that went through a fatigue protocol, which was a eccentric dorsiflexion and plantar flexion fatigue protocol. What they did for the fatigue protocol was, when they weren't able to handle the eccentric load, going back and forth in a dorsi and plantar flexion, up to 50% of what their max ability would be, that's when they determined them to be fatigued. So we saw that there is a significant improvement in proprioceptive ability here. If we dig into balance is, again, it's a little more variable, because it takes into really your ability to prevent from moving, but there's more that comes with this than just the particular joint where the tape is, as proprioception is a little more focused. But what we saw here was they looked at your ability to prevent sway from medial lateral, anterior, posterior, and what they found was that in terms of balance testing here, that we're going to jump in with eyes closed, even though they did with eyes open and eyes closed. Here we saw that with your balance, that there was a 47% improvement using kinesiology tape versus no tape with your eyes closed in terms of your total sway, while in that one-legged stance, stork stance balance test, and that there was a 39% improvement with tape on versus with eyes closed in the total sway length. So again, great results here, as expected with adding kinesiology tape into a fatigued position with a balance test. And so again, this doesn't correct for someone who maybe has a knee or hip issue, but in terms of just the fatigue-induced issues from the fatigue protocol, we see these big numbers where tape improves the proprioceptive and balance ability. And then with eyes open, we saw some good results as well. I think I like the eyes closed testing just because it takes out the visual portion of our proprioceptive input. And so if we can eliminate the visual input, I think that gives us more emphasis on what the tape is doing for the mechanoreceptors, feeding the brain with information. So I think this just gives us a little more focused testing on what we would see. And I think you would test that in the clinic as well. You would kind of commonly take out vision to test more the ability to create balance at the particular joint that you're looking for. And we'll dive into what they saw strength-wise, just because it's had great results, and there's no reason to avoid great results. And so you see here that the black bars all the way across the board, no matter what angle that the ankle was in, when they did the balance testing, or the strength testing, that the kinesiology tape group had was able to restore their strength better than both no tape, sham tape, and athletic taping. And again, I see that all day, every day with the performance on the court and on the golf course as well, is that when people are fatigued, when they're sore, when they're tired, you get tape on that area, and all of a sudden they're back, and they feel back to kind of where that they would normally be pre-soreness, pre-injury. And then so that just turns into, I mean, I do it myself when I have a hard glute workout, I'm putting tape on my glutes afterwards. When my legs are sore after a squat workout, I'm putting tape on the areas that are sore, and I can feel that my strength is restored. I can feel that I have more ability to get lower into my squats, and I have more awareness of my body when I do that. So it becomes a kind of just the normal process of when a client is sore from a workout, we're putting tape on it. When I'm sore from a workout, I'm putting tape on it because I know I'm going to benefit from it. All right, and then the conclusion of our study, the study showed that kinesiology tape significantly enhanced muscle strength and proprioception after our eccentric muscle fatigue on the ankle more than other taping methods. Furthermore, kinesiology tape surpasses athletic taping in improving static posture control post-ankle muscle fatigue. These insights can guide healthy individuals in choosing the suitable taping technique to quickly recover muscle strength, proprioception, and a static balance affected by eccentric-induced ankle muscle fatigue, thus lowering the risk of ankle injuries. And going back to what we saw with our first study, the same thing is if we are improving our position sense, we know where we are in space, we not only are helping our performance, but we're decreasing the chance of injuries. And many injuries, it's hard to know what injuries it's hard to know what injuries that you prevent, because an injury really is an all or nothing thing. If you didn't injure yourself, well, then there's no injury to know that you prevented it. But if you're able to do everything you can for your clients and your patients in that realm, then I think you're doing the best job possible. They'll be able to feel the difference. They will appreciate what you're doing. And I think you communicate that to them as well. I'm always going to tell people that I'm working with this. If you're getting tired and we're going for a long walk and your knee is sore, I'm putting the knee pro cut on your knee, and the reason I'm doing it is because we want to make sure that you prevent injury and keep getting stronger, decrease the chance of a negative thing happening, and people appreciate that. All right, we're going to dive into our third study here. The unique thing about this, unique things about this study is this was done on the shoulder. So we had the knee, the ankle, now the shoulder. This one did not involve a fatigue protocol. This was just your ability to reproduce that angle of shoulder motion, both in shoulder flexion and rotation. The other unique thing that did here is that they used the Spidertech Pro Cut in their study. So good for them. And so naturally we would expect fantastic results. But I also say that I think that fatigue protocol is very important. I think that there's no doubt in my mind if they used a fatigue protocol in this type of study and tested before and after, we would see great results the same way we saw with the last two studies. So that'd be an interesting one to do as well for the shoulder. And then the unique thing for the Spidertech Pro Cut with compared to just other taping jobs of the shoulder is that we'll see a little more clearly here soon, but the tape goes all the way around the shoulder blade, so we get complete position sense awareness for that whole scapula, which I think has a huge part in the kind of knowing where you are in space. And I felt that was something that was really important for my rehab of my shoulder. So as you can see in this study, they use the goniometer on the arm, and they tested their ability to reproduce a desired angle of rotation or flexion extension. And what they found in the study was some pretty impressive numbers. Again, keeping in mind there was no fatigue, no injury. These are healthy people. So within shoulder flexion, they saw that there was a 45% in their ability to reproduce the angle that was asked of them in shoulder flexion compared to no tape. With shoulder external rotation, certainly important with with virtually all sports. For our shoulder positioning rotation, what we saw was with the shoulder external rotation that there was a 52% ability to reproduce the position that they asked for. And then for shoulder internal rotation, they saw that there was a 57% improvement in your ability to reproduce those positions. So simple study, but I think kind of hard hitting, and gives us gives some insight into the principle of how the tape can help, and then you can take that information and apply it to your clients and patients however you see fit for them. But I think this kind of is something that's going to prove our concept beautifully. And again, this is not with fatigue, this is not with injury, this is when you're already at your best. So these are pretty staggering numbers. And within the study, they are just highlighting the importance of proprioception within the study, and they quoted saying proprioception is extremely important in the upper extremity joint coordination due to the complexity of the kinetic chain and the need for precision in tasks being performed. Upper extremity function depends on the ability to place the shoulder in an optimal position for functionality. Furthermore, proprioceptive deficits have been identified in pathological and fatigued shoulders, therefore an integral part of many rehabilitation programs in the attempt to improve proprioception to provide improved joint position awareness. I think that says perfectly what I found with my shoulder, what I find with my clients. Is just that was a big part of my rehab protocol, getting the awareness. So then everything I did past that in terms of rehab exercises, in terms of further therapy that I was doing, they all were helped because I had more awareness of where my shoulder was in space. So this made everything more successful by just applying kinesiology tape on my shoulder. Specifically the shoulder pro-cut. And the nice thing is too, if you keep in mind, this is something that goes on your shoulder all day, every day. It doesn't come off. It's on there for the entire week. This is something that's constantly giving you more information about the shoulder. And going back to our study, the purpose of this study was to determine the effect of kinesiology tape on the shoulder joint repossession sense compared to the control group. The findings indicate that kinesiology tape does have a statistically significant effect on reproducing joint position sense, air, inflection, external rotation, range of motion of the shoulder. So again, proving our concept, and also proving what I know to be true with myself and what I see to be true with a lot of the clients that I work with. We'll go over the shoulder pro-cut. I mentioned that a huge piece of the proprioceptive improvement that I feel is the posterior portion of it, and you can see with our fellow here, our gentleman here, that it covers. We're looking for it to kind of go up for over top of the shoulder, down beside the scap and over the infraspinatus. So we'll dive into our video here, and we'll kind of walk our way through the application process. And also we'll see exactly how it looks and how it is applied. So with all of our kinesiology tape, because they are one piece designed to cover all the important areas of the joint that's being applied to, we're gonna bend and break all of the black lines, which happens to be the perforations, before we apply the tape. This just makes the application process as easy as possible, and we're able to kind of flow through this in a really simple way. When we apply here, we're going to go just below the AC joint. We're going to kind of cover the bottom part of the shoulder joint. And so with that, we're going to get a lot of awareness of what's happening at that at the insertion for the supraspinatus and also at the AC joint. And then with all of the portions of this application, we're going to stretch the muscle we're applying to make sure that we're never running out of range of motion, to make sure that we're promoting proper function range of motion, not limiting it. So with our second strip there, we're going over top of the supraspinatus. We're moving down the medial shoulder blade, that medial scapula now, over top of that rhomboid. And then when we get over with our last piece, the number 4 tab there, we're going to go across the infraspinatus, and so we're going to abduct the arm across the shoulder to make sure that we don't run out of range of motion with abduction now that the tape is on. And you can see how it grabs the skin and gives that nice accordion look with when she comes back into her normal kind of anatomical position. We're going to use the next strips, go down over top of the deltoid on both kind of like the anterior posterior angles there. Like so, and then again, we're doing with no stretch in the tape. We're doing with the muscle in a stretch position, and the last 2 strips, they will go over both the bicep and the tricep. So to do that, when we do that, we're gonna stretch the muscle that we're applying to. So when we get into that bicep, we're gonna stretch the bicep and then move up towards the attachment in through the shoulder joint. So we'll have to kind of thread through the bicipital tendon there, like so. And then for the tricep, we're gonna flex the arm up overhead. We'll give the elbow a bend, and then we'll move back towards the shoulder joint as well, getting over top of that tricep. And so you can see we're covering all the important areas of the shoulder joint itself, down the arm in terms of the deltoid, bicep, tricep. We're getting the rotator cuff in terms of the supraspinatus, medial shoulder blade with the rhomboids, and then also across that infraspinatus, which I think is a really important piece, especially with so many people having kind of like a rounded forward posture, sitting on a computer too long. Infraspinatus gets really, really tight and sore, and so that infraspinatus piece ends up being a really, really impactful strip in my mind in terms of normalizing the muscle tone there, but then also giving constant overall proprioceptive awareness for the shoulder joint itself. Okay, and so that's going to essentially wrap up the education point of our webinar. We're going to dive into our questions here very shortly, but we're going to quickly review what we set out to achieve with our goals and our simple goals, where we want to learn how Spidertech can be used for improving proprioceptive imbalance, and then also how we apply our knee ProCut, our shoulder ProCut, and then with everything we do at Spidertech, we're trying to leave a lasting impression, and we're doing that by offering the best, highest quality kinesiology tape experience for your clients. We do believe we have a tape for every client, being that we cover we have one-piece tape for all the joints and areas of the body. And by doing that, we're able to improve posture, tension, swelling, any fluid, essentially, in terms of inflammation, swelling, bruising. We can boost the proprioception awareness in the body, as we just mentioned. It is perfect for all injury, rehab, and pain. The secret of it is the lift in the skin, and it is something that is worn 24/7. In between your treatments, and so they're getting constant therapeutic benefit from using the tape when they're not in your office. So as a result of that, it becomes a treatment between treatments. Your clients are getting the higher quality of care. They're constantly improving their issues and conditions, and then it also, because of the one-piece machine cut visual portion of it. It looks really good. It looks professional. It looks high quality. It stands out when people see it. When people see it on your patients, they start asking questions like, "What is this? Why do you have that? How is that helping?" That turns into questions about you as a therapist, and it's going to have a positive impact on the perception that people have in terms of your high quality and your high value as a therapist, which is a huge piece of word of mouth and getting more people in the door for you to continue helping everyone in your area. That's a wrap. Let's kickstart some questions now. Just kind of add them in the chat, and we'll work our way through them. All right, so the first question we'll tackle here is going to be a good one. So the first question is, how do we take advantage of tape, kinesiology tape, in our core training? The answer to this one will be depends in a lot of ways, and I'll try to highlight that as we go, being that core training can be different for whoever the person is in front of you. People come in with different postures, different positions, different needs, different imbalances, and so the core training that you should be giving them is one that kind of improves that person as a whole. But where the tape comes in is pretty significant. I think if we take the mindset of what we saw today with the fatigue protocols, we'll start with that. So a good example would be in mothers recovering from giving birth or from C-section. That would be the injury protocol. That would be the injury that they use, and then I think how the core training can help with tape would be a good way to tackle that. So what they found in numerous studies, they got great results with using essentially the low back pro-cut on both the low back and the abdomen of people in those studies. And so you get tape on both the anterior and posterior part of the core. And what they found was using the tape in those ways compared to using no tape at all, the mums, they increased their strength much quicker. They found that their waist size decreased significantly faster, and I think that's because the fluid moved out of the area, and so now all of a sudden we didn't have that pooling, and there was less kind of puffiness. We saw the disability went down, pain went down significantly, and as I mentioned, the strength went up. In addition to that, the core was able to heal itself faster. There was less situations of diastasis recti happening or getting worse. So all of these variables that you would expect or you'd want to see improve significantly, the numbers were huge. And so I think from that standpoint, that's how you would kind of think about taping to the core. How I would generally do it if we're dealing with someone maybe who's a little bit overweight and wants to get in with core training, I would, again, tape the low back. I think with that we get more awareness, more proprioceptive awareness. I think we also get those erectors, which constantly are going to be tight with someone who goes into an anterior pelvic tilt. We get normalization of those muscles. We get the low back pro-cut on the abdomen as well, so we get the feedback, the awareness, the proprioception to the abdomen as well. So I think that's how I would tape both the front and the back, and I think for core training that would be a huge improvement. There's a number of studies that look at being able to do like a Sorensen's like back extension test and being able to improve your endurance with tape, and that just taping the low back, the erectors, and those studies they also see improvements in the ability to create an endurance, and that they commonly will the reason for that they'll say that happened was your ability to like lift in the skin allowed lactic acid, it allowed creatine kinase from the muscle breakdown from the fatigue to kind of move out of the area. So the nerve receptors weren't as stimulated, and you didn't get as sore and fatigued as fast, and so you could maintain your endurance more than you could without tape. So there's all these like individual pieces that look at being able to help your core with tape, but that would be my suggestion. You get tape on both the front and the back for core improvement. Angus, do you mind reading if there's another question there for me, buddy?
Reading?
Yeah, is there another question that came in?
Not right now.
Yeah. So I will. I mean, I found it pretty interesting with the tennis athletes that I've worked with was that idea of getting tape on the adductors for someone who's has to control a split position on the clay courts. I think you could kind of apply that thinking throughout, because not only do those muscles have to stretch to allow you to get into that split position, but they also need to be able to control your body, so contract, to prevent you from going into a position where you're vulnerable for muscle tear, strain. And so it's not only just like a muscle relaxation thing, but it's also we also need a muscle control piece to go in. So I think that's where the proprioception is so interesting, where it's just not like a muscle relaxation thing that we're looking for with the tape. It's a muscle improved function thing that we're getting out of this the addition of tape being put on a tired area or an area that we know is going to be fatigued. And I will say that the way I would tape for improving proprioception is going to be the same way that I would tape for pain or muscle tension. I'm going to always stretch the muscle that I'm applying the tape over top of. I'm going to apply the tape without stretch tension in the tape. I'm going to lay it down over top of the skin that way. And the reason for that is that makes sure that although the tape is stretchy, it has 140% stretch to it. But it only goes 40% more of its original length. There's joints in the body like the shoulder and an abduction that go more than 40% increase in range of motion. So if you use that principle of taping, stretching the muscle, taping with no stretch in the tape, you're going to ensure that you never run out of range of motion. The skin's never going to have to deal with the tape coming to end range, and that's where a lot of our skin injuries come from, is that the tape can't go as far as your joint's trying to take it, and so as a result, either the skin has to give or the tape has to give, and neither one of those things are going to be a positive thing for your patients. So stretch the muscle, don't stretch the tape, and you'll have great results. And you'll essentially will eliminate all the downside with all the benefits of improving proprioception and pain and tension. All right. Well, thank you everyone for joining us for webinar number 6. Fun as always. I hope this was informative. This will be on our website. You can go back and look at it at any time. You can keep sending questions through email to us, and I look forward to jumping into webinar number 7 with you next month to tackle a new topic. Without further ado, if there's no more questions, we'll call that a wrap, and I hope everyone has a great rest of the day.